Change takes time, growth takes work, but showing up every day is progress.
This is the 365 Proof Podcast, where we share real stories, honest conversations, and practical insight from mental health experts, addiction specialists, and people living the message.
If you're looking for guidance, inspiration, or real insight into recovery and purpose, you're in the right place.
Hey, everybody. Welcome back to the 365 Proof Podcast. I'm your host, Daniel Phyfer.
I'm Courtney Milan, co-host.
And today we have a very special guest who we've had on the list for quite a while. We're very excited that we've gotten her here from her busy schedule. We have Dr. Avni Patel. Welcome, Doc.
Welcome.
Thank you for having me. I'm really excited to be here. This is one of the podcasts I've wanted to be on for a while.
Oh, man.
Nice.
We like to hear that.
We do.
Dr. Patel is a board-certified psychiatrist, a graduate of residency from the University of Mississippi. She also has her MHA from Oklahoma State. She has a private practice, Mississippi Psychiatry and Wellness.
Mm-hmm.
She also does a million other things, including she works part-time for a community mental health organization here. She's certified in sports psychiatry, which I'm really excited to hear more about. So, Dr.
She's a psychotherapist.
Yeah, she's
too.
a psychotherapist. Yeah, I mean, the bio is
It's
pretty
endless.
insane. It's very impressive. But all that to say, she's got a unique perspective on what it means to treat people in psychiatry from all walks of life, which I think is a skill set that maybe not a lot of physicians are able to have.
Right.
And so, Doc, just tell us, you're a Mississippi girl.
I
You're
sure
from
am.
here. So the way we're going to roll with this is like, let's start with you, and then we'll just kind of move on as we go.
Yeah.
So tell us all things Dr. Patel.
Happy to. Again, thank you all so much for having me. I'm
Absolutely.
so excited. And one thing I do love to do is talk. I jokingly say, as much as I talk, I do observe.
You're in a room full of similar people.
That's
for
right.
sure. So,
And so, I guess one of the best ways to start is just kind of telling y'all where I grew up. So
Yeah.
I grew up in Columbia, Mississippi, near Hattiesburg.
Okay.
My parents both immigrated here. And so I grew up with really humble beginnings. And, they worked so hard to give us what other people would deem to be the American dream. And so I have two younger siblings. They're also physicians.
Oh.
So my sister's plastic surgery resident. My brother's internal medicine. We'll
Wow.
see if he does a fellowship. But yeah, I grew up in Columbia, and I've always dreamed of becoming a doctor. And so my grandfather was huge into philanthropy. He was a farmer. And before he passed, he said, I really want for you to pursue a career where you feel the way I do when I help people.
Mhm.
And unfortunately, he was not able to see me become a
Aw.
physician, but I'm so proud of that. And hopefully, I'm able to honor him in that way. And my parents have always been super, super supportive. And so they have never missed an awards day, a tennis match. I mean, you name it, they were always there. And so I think that plays a huge role in the support that you have and just in achievement. And so I went off to Mississippi College and loved my time there.
Mhm.
And then I decided, it's funny, I said I would leave Mississippi and I'd never look back. So I said, I'm going to leave Mississippi
Yeah.
for medical school. I'll never look back. I got into medical school here, early decision, loved it. And then I said, I'm going to leave for residency and never look back. And over time, it's interesting. My heart really changed throughout college and medical school. I fell in love with the people of Mississippi. I saw the gap and the need. And I said, if everybody left, who's going to be around to take care of the people
Right.
here that I care very deeply about?
There you go.
And so I stuck around for residency, but I was interested in having a variety of training experiences. And so I was always the more is more. When I was in training, I decided I wanted to complete several fellowships. So I did several in leadership. I was really big into advocacy, organized medicine, and that really kind of helped me have an all-encompassing experience throughout training. And I also decided to pursue that certification in sports psychiatry. But interestingly enough, I never thought I'd end up being a psychiatrist.
Really?
When I entered medical school, I remember telling my parents, the last thing I would ever do is become a psychiatrist. And they laughed at me. And
Yeah.
they said, yeah, I guess we can see that, but we never know. Just keep your mind open.
Right.
And so I actually planned on doing anesthesiology. I did it
Okay.
all the way up until my fourth year of medical school. So match was about to
Really?
come around, and I realized I made a mistake.
Oh, wow.
And everyone was happy and excited about match and residency. And I said, if I sign away the next 4 years to something that I don't know that I love, what am I doing?
Wow.
And so I took a step back and I took a gap year. That's when I got a master's in healthcare administration. And when the pressure was off because I had lots
That
of
was
different
smart.
ears.
Yeah.
Right, I had lots of different people in my ear. They were saying, if you end up pursuing psychiatry, no one's going to take you seriously. You will not be able to advance in leadership. And there's so much of the stigma, even in the professional community. And truthfully, even my parents, they said, you did not go to medical school to become a shrink. That was not the idea of medicine that they had in their brains. And the best thing someone can tell me is you can't.
Yeah, of course.
Because then I will. So I did. And I had a mentor, and, I attribute, her name's Dr. Beverly Bryant. She was the chair of child and adolescent psychiatry at the time at the university. And she told me, she said, Avni, anyone can be a psychiatrist. I can teach anyone how to be a psychiatrist because evidence-based information is something that can be learned. She's like, but what you can't teach is how to connect with people. And what's going to make you an excellent psychiatrist is the thing that can't be taught. She's
Couldn't
like,
agree more.
And it just meant the world to me. And I remember crying in her office telling her I made a mistake. Yeah. She wrote me a recommendation letter for anesthesia.
Wow. Yeah.
And so I pivoted. I took the year off. That was the best year of my life because I didn't even know I wanted to be a physician anymore. I thought I was going to go into hospital administration. I wanted to be a CEO or CMO of a hospital.
I was curious based on that. Yeah.
But then I realized I miss taking care of patients too much. I love people way too much not to care for them. And I have found over my lifetime the best doctors are the people who really care about you.
Yeah.
And so I pivoted. I ended up pursuing psychiatry, and it was the best decision I ever made, and I've never looked back since.
What an incredible journey.
Wow. I mean, I'm not very in tune with all the young physicians that are coming out. I got buddies that are anesthesiologists or they're, internal medicine doctors or whatever the case may be, but I can't think of many young people, especially from Mississippi, who decided on psychiatry, stayed here. Because if you look at the landscape of psychiatrists around the metro area, let's just use that for an example, there's not really any younger, we're the same age, so no shade. I mean, it was exciting for me to be like, oh, she's my age, and she's like, this is all
refreshing.
I can talk to her about different things because that's a real difference.
Right,
it makes a difference, and so that energy of not just based on age, but one thing I've learned about you just from knowing you as much as I do, which is not as much as I would like, is you're a seeker. And look at the resume.
Right.
You're constantly trying to learn more, and I relate to that more than anything as just a regular dude. But I see that, and it makes me excited, especially being in the field of behavioral health care, dealing with mental health and substance abuse, to just kind of have, because 20 years down the road from now, we're going to be the people that we're talking about right now.
Right.
And it's like, I hope that there's younger people that come into this way, the way we have, if that makes sense.
Makes complete sense.
So yeah, that was exciting for me when I actually saw when you were opening up your private practice, I saw like a link, and I reached out to a couple people and I was like, what's the story on her? And they were like, she's like your age and she's smart as a whip, and she's starting her own private practice. And I was like, I told Carly, I was like, you need to get over there. You need to meet her ASAP.
Exactly.
Yeah.
Y'all are gonna have me blushing. No, I'm so honored and so grateful, and I'm so thankful to my family. One of the things that I really want to empower young physicians and people who are in this space to do is don't be afraid of private practice, and I think our patients need it. I realized there was a market gap. So something that, as I was thinking about next steps, I knew I wasn't like everybody else. I was never like that in residency, and I figured I wouldn't be like that when I was coming out in practice. And I really enjoy learning. I think the moment we stop learning, we're doing a disservice to ourselves and the people that we serve.
Mm-hmm.
And so for me, I knew I wanted to have a variety of things. I wanted to continue to learn, and I wanted to be able to touch people across multiple sectors. And so, interestingly, I am not an athlete. I am a pageant girl.
Yeah.
And
really?
So, yep. And so for me, athleticism, I've got 2 left feet when it comes to that. Have no coordination, except when it comes to dance. That was my pageant.
Well, there
talent.
you go. That's something.
Okay.
But I can't hold a note for my life. So I knew that was out of the picture very quickly. And even when I played tennis in high school, I was, I think I was just the charity member on the team. So, and I never really grew up watching sports because academics was always the priority for me. I was just a big old nerd. But what I realized throughout training is I ended up being funneled a lot of our quote unquote VIP patients. So I was seeing impaired physicians, I was seeing hospital administrators, I was seeing a lot of our clinic staff when I was in training, and I kind of became the go-to psychiatrist. And so when I was looking at the sports psychiatry curriculum and the training behind it, right, you're looking at how can you treat the athlete, the whole person, people who have or who are under immense amounts of pressure and have a lot to lose, but who are also very ambitious and disciplined in their life, but also hurting. And I noticed there was an overlap between other high achievers like hospital administrators, physicians, attorneys, CPAs, et cetera, and athletes. And so I thought, well, if I got sports psychiatry training, it can't be too different. I can use some of those concepts in treating a wide variety of patients. And if not, worst case scenario, well, I think education is never wasted. You'll be able to find a way to incorporate it in your life in one way or another. And also, I had great training at university. And so what I realized is I'm pretty comfortable teaching a wide variety of patients. I can treat addiction, substance use disorders, had amazing training there. Also child and adolescent population, because in Mississippi, truthfully, you're it.
Yep.
And then had great geriatric psychiatry training. And so I treat in my private practice ages 5+.
Wow.
And something else I realized is that I don't want to be bounded by time. And so I set up my model to be more concierge in nature. And also, how many times have you tried to schedule with a doctor's office and it's near impossible to get scheduled or even be able to talk
for an ENT appointment, literally.
Or even be able to talk to your physician. And to be fair, I think, physicians and other mental health care providers and just providers in general are stretched in many different ways. But I didn't want that. I wanted to be there for my patients, and I wanted to handhold in a way. So all of my patients get to text me directly on a HIPAA-compliant line, and they schedule directly with me. You don't have to go through Sally Joe or anybody else.
I can't get a secretary to answer.
Yeah.
When I call my I can't get anybody to answer.
Yeah, and so for me, I just wanted to make it as easy as possible. And something else I also realized is, for some people, and especially in something as sensitive as mental health care, there's even more barriers. And so for some families that I know, I don't ever do it on the initial appointment, but I do house calls as well. And so I go into their environments, and it gives me a better idea of kind of who they are, what they struggle with. And that's been a really neat part of my private practice, that I realized there's just a huge gap in the market and a gap that I could fill.
And
that is wonderful.
And making access as easy as possible is so important. That's a big thing for us. It's like you're dealing with people in crisis.
Right.
I mean,
good point. Yeah.
You got to move.
That's right.
Quickly and efficiently.
Right.
Right. And safely and all the things. But, when you have a smidgen of willingness from somebody who's struggling with mental health or substance abuse, whatever the case may be, and you wait a little bit too long, that smidgen disappears quickly.
That's right.
Sure does.
They got it all figured out.
I love that. And it personalizes it. It humanizes you. Because, also in this world, at least on the mental health, behavioral health care side, it's like doctors are pushing, there's that motto everybody has, like, doctors think they know me, they don't know, all this stuff.
Right.
And so for you to be able to kind of humanize yourself as a person is also super important too.
I agree. I think also, that's what allows for people to be able to build that level of trust with you, because they're essentially coming into a stranger, telling them the most vulnerable parts of themselves, things that their families may not even know. And they're just hoping that you can help with that.
Yeah.
Or they're scared to death and they're like, I'm not letting this wall down to let you in. And that's one of the really neat things about the way I also treat. So I'm also trained in lifestyle psychiatry, and there's a new textbook coming out from the American Psychiatric Association. And I'm the lead author for 2 of the chapters, one of them on sports psychiatry and the other one on how we can incorporate lifestyle psychiatry into corporations, organizations, and global health policy. And so the 5 pillars of lifestyle psychiatry are physical activity, diet, nutrition, social connection, harm reduction when it comes to substance use, and hopefully no substance use at all, and then mindfulness. And so it's something that I incorporate into all of my treatment. So when I treat my patients in my private practice, I typically have a pharmacologic medication regimen, supplements sometimes if there's utility for it, or if there's fear, right? And then diet, nutrition regimen, because there are superfoods that I believe can help with whether you have depression, anxiety, bipolar disorder, even OCD, and then exercise routines. Because interestingly, if you get too much aerobic exercise, you can actually incite a manic episode in some people.
For sure.
And then finally,
Makes
I'm one of the few
sense.
MDs who still does therapy. And so for some of my families and patients, it's also really hard to find, a therapist that they feel comfortable with or has the training in some of the skills in the areas that they're hoping, to seek treatment for. And so I'm always very transparent in what my limitations are. I'm not certified in EMDR or anything like that. But what I am really good at is I've been trained in cognitive behavioral therapy, interpersonal therapy, psychodynamic therapy, acceptance and commitment therapy, and then even some of the executive coaching, because executive functioning is something I understand, right?
Yeah, absolutely.
And so having that one-stop shop is really helpful. But I also incorporate some of that in the work that I do with other populations. So at Harbor House, which is a grant-funded rehab, I get an opportunity to treat dual diagnosis patients. And many of these people are post-incarcerated, homeless, have burned all of their bridges, and a lot of them will say, I think this is the first time that somebody's actually made me believe I deserve a second chance.
Wow.
And even with medications, many of them have been burned or they've been labeled, and many of them have never really understood what their diagnoses are. And so I'm so grateful to be at a place that allows me the time to spend with patients. And it has changed the game in terms of people completing treatment and how proud they are. And many of them will call back and say, hey, let Dr. Patel know I'm doing really well. I've gotten a job. I'm doing X, Y, and Z things. Or if they've relapsed and I see them again, they're saying, the person that I was so worried about telling that I'd relapsed was you, but I also knew that I would feel safe and I'd be able to get back on track and reach my goals if I got to come back.
Yeah.
And that's the type of compliment that I think
That's the ultimate compliment.
That's the ultimate compliment. Yeah. For people, for you to be able to invest so much in people. And I had no idea how healing that would be for me.
Yeah. That's
incredible.
When you see the light come on in that population, it's a beautiful thing because it's a challenge. I mean, we see some of it here at Defining Wellness.
Right.
It's people that have lost any sort of family support or leverage, even to use that term,
Right.
to come together as a unit, whether it's family, employer, whatever the case may be, with the treatment team and say, hey, man, I know you want to leave treatment, but you really need to stay.
Right.
I know you just did detox and you feel better, but you really need to stay and figure out what the root causes of this stuff is.
The thing that I teach all of my patients, whether in my private practice or at Harbor House, I always tell them, I say, what do you think makes someone successful? What creates a successful person? And it's interesting because we all have our own definitions and variations of that, and we tend to project that, onto ourselves in terms of what our idea of success is. But the way that I deem it is you don't have to be the smartest person in the room. You don't even have to be the wealthiest person in the room, because I know societally that's what we deem to be successful in ways. But what I say is that the difference between successful people and those who are not are the people who are willing to bet on themselves.
Mm-hmm.
I started a private practice. I was willing to bet on myself.
Right.
And I was like, and when you're in treatment, you have to be willing to bet on yourself. And that's where you really get people. That's where you see the fragility in people, because they're so fearful of betting on themselves. And I was like, but if you're not willing to bet on yourself, then how can you expect someone else to? And that I have found to be a very powerful tool, just even a powerful phrase and a mindset throughout treatment.
Right.
Because that's what creates success.
Yeah.
It's going to look very different.
I kind of have a similar conversation, but from like a peer recovery standpoint, where I'm just like, stop trying to show up for everybody else and just show up for you.
Mm-hmm.
Right.
For the first time in your life.
Absolutely.
Just show up for yourself. Like, that's it.
Yes.
So different, but similar. I mean, all right. So I have so many questions. This is going to be great. Did you take away a lot of good, you're a business owner, everything kind of runs through you, which is great. But when you got that MHA, couple of questions. Did that help you with starting your own business, number one. Number two, did it kind of give you a lens into working with some of these more high achieving people?
That's a great question. Yes, I think all education is helpful. So what it did allow me to do is kind of structure into different pockets what's required in business. So, right, HR, leadership, what does leadership versus management look like? And what people don't realize is management and leadership are two very different things. And it's actually really helped in my professional life in other ways when it comes to organized medicine leadership, et cetera. And one thing that I will say a master's in healthcare administration did not give me, it's not going to be as granular with the financial piece as you would if you got an MBA. Right. So I have contemplated going back and getting my MBA just to have a little bit of additional training. But honestly, I've always been somebody who I think if you do good things will come to you.
For sure.
And
Right.
so I found that to be very much the truth in business. Now, I will say I do like to disclose, my practice in order for me to be able to give that level of time and effort and attention to the people that I'm treating. I am a cash pay practice, but like I said, I do make sure that I want to touch a variety of people. And so I'm also in managed care, and I manage a Medicaid contract on the behavioral health side. Because the truth of the matter is that for people to get care, there's an in-between, division of Medicaid and people receiving the care, and that's managed care organizations. And so I really wanted to make sure that I got invested because I want to make sure that people get the care that they need to be able to get better and reach their goals. And so I have found that my master's in healthcare administration has been very helpful from that regard because there's much more administrative work that's involved. And, what's interesting is that being trained in psychiatry has definitely helped me in terms of navigating people. And so what's amazing is a lot of my mentors came back to me who are non-psychiatrists, by the way. They're other specialties, and they said, you know what? We were wrong. We were wrong to tell you not to pursue psychiatry. It's been amazing to see what you've been able to do. And then also you're starting to see more and more psychiatrists in administrative leadership because you get these people skills that we otherwise don't necessarily always get in training. And I will say this, it has to be something that you're very much interested in. There's an emotional intelligence piece that can't be taught. And you don't have to be a psychiatrist to have that. And you can also be a psychiatrist and not have that, quite frankly. And so I think what's interesting is just how I've been able to see my career evolve with that training and incorporating some of that subtly. Our brains are so powerful, and it takes in so much information, and there's a lot of subconscious connection that happens. And even with that, I love teaching my patients. I teach this in all of my practice settings, but there's so much of evolution that still plays a huge role in how we think and the behaviors that we have. And I'm happy to get into that. You may have asked me a second question. I probably didn't answer it, so
you
sorry.
You did. That's great. That's great. I mean, so, all right, so you finished residency. How long, did you jump into private practice immediately post-residency?
I sure did. So we have boards that come once a year. So being board certified is kind of that ultimate final test.
Yeah, you made it.
Yes.
You made it. Yes. And so
You're trustworthy.
Yes.
that is correct. And so I knew I didn't want to be distracted with boards. And not because I think a test should define you, but really to show yourself what you've learned over the last 13 years of my life.
Right.
Since, I started college. And so I graduated in June of 2024. And as soon as I graduated, I started at Harbor House in July. And then I had really been doing all of the research to figure out, how do I start a private practice?
Yeah.
There's no manual for how to start a private practice. And the manuals that are out there are going to cost you a lot of money. They would cost you about as much as I made in residency for an entire year. And I said, you know what? I don't think I can do that.
Yeah.
So I spoke with a lot of people. There are a lot of people who are there to help, and there are a lot of people who are going to give you advice that you should absolutely just take with a grain of salt.
Yeah.
And so you realize very quickly not everyone's going to be there to be on your team, but that's okay. I've always been somebody who believes in paying it forward and being connected. You'll get connected to the right people who are there to help you. So I was very fortunate to find some friends out in California who had started their own private practices and gave me great advice. And so I talked to a variety of people and took that information, got organized. And so as soon as I took my boards in September, I'd already slowly been working on it, but then I was like, okay, it's go time.
Yeah, here we go.
And so I started my private practice and really put all of my energy and effort into it. And in a month and a half, I got it up and running. And so I started my private practice in November. I also started my managed care role in November of 2024.
Big month.
Big month.
Yeah.
And it was
Right.
great. I also knew, right, the doors were, even if the doors were open, people were not necessarily going to be flooded in because there's
Right.
still a lot of stigma around mental health care in Mississippi. And what I think a lot of people have in terms of the idea and the experiences they've had with it. And so that can be a little bit difficult. And it's also like, how do you market mental health care, right?
Right.
And for me, I have found my best referrals have been word of mouth, either people that I've known in the community or my patients. My patients have referred me so many other people, and that's been very rewarding, and it allows me to be selective. So something else I like to do, because here's what I always tell people, I want to make sure that you feel comfortable with me. This is an investment that you're making, and if you don't feel comfortable, if you don't feel like I'm going to be the right fit for you, or if I feel that my skill set is not going to be the right fit for you, I don't want you to make that investment.
Yeah, it's not personal.
Right.
It's not personal.
Yeah.
I want you to get matched up with the right person. And so anybody who does a brief consultation with me, if they don't get to see me, I make sure that I set them up with someone who
For
I
sure.
think would be a good fit.
Right. There you go.
I'm glad you brought that up. Like, marketing mental health care. That's something
yeah.
that is quite literally my job.
Right.
But
And you do it very well.
Well, thank you. But it's I have found that people trust people, especially in the South, more specifically in Mississippi. Knowing somebody on a personal level makes me much more comfortable. Because if I look at a place and I see I know these 4 people in leadership are
Right.
running this place. I trust these people implicitly. Obviously, you have to do your due diligence on the
Of
care, all
course.
that good stuff. But like that is such a big hurdle for most people, I think.
Right.
And we talked about humanizing yourself. The whole point of this podcast is obviously education, a few other things, but like we want people to know who we are also,
Right.
Right.
because that really is
That's
what
the key.
matters.
Yeah.
Somebody
Definitely.
calls me and they're like, I think Joey is bipolar. And I'm like, well, he might be. And it kind of sounds like it, but I'm not a doctor. But let me tell you who you need to go see.
Right.
Go see Dr. Patel. And she will do an assessment, an evaluation, all these things. So, that really is how it works.
Yeah.
And,
That's
it
the best
matters.
referral, word
Yeah.
of mouth.
I think
Like,
so too.
And
Yeah.
when your patients refer you other people,
Oh, yeah.
not only is that the best, that just keeps telling you why
Yeah.
you're doing what you're doing.
So I'll tell y'all another line of mine. I always tell my patients, I said, look, I can't promise I'm going to hit a home run the first time, but I can surely tell you that I will try, and I usually do.
Yeah.
I love
And
it.
so that's part of the reason why I spend so much time with my patients. I spend a lot of time explaining diagnoses. And what I also say is that if there's a lot of fear around diagnosis, I said, let's not focus on that
Yeah.
because labels can be hard.
Mhm.
Now, it's interesting because with the younger generation, they really want labels and they're attracted to that. But I also don't really necessarily love that because a label can follow you for a very long time. So you want to be very thoughtful and judicious. But what I also like to spend a lot of time doing is explaining medications, how they work, how your brain works, right? What you've got going on there in terms of what connections are misfiring, or maybe if there's, right, we think about serotonin depression, that's
Yeah.
usually on the lower side. And so what we're doing is we're replacing it. It's like you're going into a car shop and you're getting a tune-up. And so it's not something that I want you to be afraid of because we do that for our physical health, and we should absolutely do that for our mental health. And interestingly, talking about just kind of, a younger person and that being exciting, I'll tell you, it's a double-edged sword.
Yeah,
So,
absolutely.
I jokingly say, I'm a 50-year-old trapped in a 30-year-old body, and so do not let my looks deceive you.
Yeah.
And that works both ways. Sometimes people are like, well, I think I want someone with more experience. And what I encourage people to do, I think there's something to be said for experience, and I have so much respect for that. In fact, most of my friends are 40s plus, so I spend a lot of time with people who have a lot of life experience. But what I tell people to focus on is, who do you feel most comfortable with from an education and knowledge standpoint, right? I've always been very transparent, and I love working with my patients and their primary care providers as well, to be able to make sure that we find the right fit. In fact, I just did that the other day where I had a patient that said, hey, would you mind calling my doctor, just want to make sure that they're okay with it.
Mhm.
We had a fantastic conversation and a great connection. And I don't think that age is necessarily a factor of that. And so, but I will say with some of my kiddos and my teenagers, it's great because I like to think I'm still closer to youth, where they feel a little bit more comfortable with
Nice.
me. Although my brother likes to remind me that I'm very old and I'm only getting older.
That's funny. I can relate to that. I not only from like a colleague standpoint, but from, you know, somebody who may need help. When I get like a young guy, I've talked about this like every week, but I just feel, I don't know. I'm
Passion.
so,
Yeah.
I'm just like, dude, I'm going to help you.
Yes.
Just let me
whether
help
you
you.
like it
Please.
or not.
Yeah. Yeah. So, okay.
I was going to ask Dr. Patel, do you think are we making progress with it being more acceptable, mental health? I think so.
I think so. I also think we're seeing a huge generational shift.
Yes,
And
bingo.
I think social media plays a big role in that.
Yeah.
Yep.
And so what I have found as a whole, so interestingly, I did publish a textbook chapter and I teach clinicians about kind of what we've seen in terms of how social media affects adolescent mental health, the pros and the cons, and even created an adapted screener that is free for clinicians to use to be able to screen patients for that and help with how do you treat that, right, and walk through that journey with families.
Right.
And the truth is it takes everyone in the family. And what's interesting is that screens have really changed the way that we view other people and even, I think, interact with other people and view ourselves.
Mhm.
And so there are some studies that have shown, you know, we get dopamine hits. I mean, there were only 4 or 5 things that gave us dopamine
Right.
hits, okay? So drugs break the glass ceiling, so that's number 1. Sex,
Mhm.
power, money, ego, that can kind of be rolled into, 3, 4
Yeah.
type of a thing, and then food. But now you've got an interesting new player in the game, and that is social media.
Mhm.
Because when you get a like, there's that instant gratification. And I have fallen very much guilty to that.
Of course.
And I believe in taking breaks from social media, and I've really transformed the way that I use social media. It's more to connect with the people that I otherwise wouldn't get to connect with, and that means people in my life and my network. And I've also switched which platforms I'm more active on, which has been interesting. I've never had TikTok. I understand it.
Yeah.
And I understand, right, the addiction that people can feel. And so one of the things that we'll probably see addressed in the updated DSM is going to be, what does problematic internet use, problematic social media use look like? How do we define that? Because there's definitely some pathology there.
There's no doubt about
I
it.
would think the majority of the planet would meet criteria.
Yeah, there's no doubt.
I mean, I do probably.
Yeah, me too. I mean, let me ask you this. I have a theory, an uneducated theory.
Okay.
With this younger generation, I feel like that was a good question, and I feel like you kind of alluded to it earlier when you said that young people want labels. Have you seen with this younger crew? I say younger. It's almost like it's a flex to be like, yeah,
I've got anxiety.
I forgot to somebody will go out of their way to be like, I forgot to take my Lexapro this morning.
Right.
Or, oh, sorry, I got to go see my therapist. And it's kind of like, have we seen, and I don't know if it's being used as like a justification for poor behavior in certain areas or what it is, but like, I feel like now we're kind of putting these, I don't want to call them issues, but issues up on like a pedestal in a way to like, do you see any of that from where you sit?
I absolutely see that
Yeah.
all of the time. And, as thrilled as I am that there's not as much stigma around
Right.
it, my concern is people pathologizing themselves for behavior that should be considered normal, right?
Mhm.
Anxiety is a normal thing to have. It's when it's so great that it starts impairing your life. Having seasons where you're feeling a little bit more sad than others
Right.
is also perfectly normal, and it is appropriate to have that. And it doesn't necessarily mean you have major depression,
Right.
right? And so the way that I like to explain my patients is that medications are an amazing thing, and they're a tool that I think we should use, but it doesn't always mean that it's permanent, and particularly in some diagnoses. Now, if you've got bipolar disorder, schizophrenia, I always like to manage expectations and say,
Sure.
we might be on medications for the rest of our life, but
Yeah.
that is okay. This is genetic. There's other components, and this is something that you didn't choose, but wouldn't you like to have your quality of life back?
Yeah, for sure.
Right? And
Yeah.
so I focus more on quality of life. But with the younger people, I have a little bit of a different conversation. What I explain to them is our brains do not fully develop until we're about 26 years old, give or take a few years. There's so much neuroplasticity and changes and pruning that's happening within our brain and those connections that's going to continue to change as we get older.
Right.
I also found that with the pandemic, we can't ignore it. I think that really did a number on people. And I remember saying after the pandemic and even during, I said, in about 5 years, we're going to see a very different population worldwide.
Yeah.
And sure enough, we're seeing that. I found with adults, they have less grace and patience for each other, right? With children, you see more impulsivity, more desire to create connection. And I think that if they can label themselves with something or say, hey, I'm so sorry I blew up on you. It's because I have really bad depression.
Yeah. Yeah.
And interestingly, I saw this in residency. I had some residency mates who were like that. And I remember calling them out and saying, I understand that and I fully respect that and I'm very empathetic toward that, but that is not an excuse for for being disrespectful to
Yeah,
somebody.
for sure.
Right.
For sure. You know, I mean, you even see it with like trauma. You know, people will weaponize their own trauma.
Oh
in some
yeah, for
ways.
sure.
Or they'll be like, "Oh, I'm just OCD. I'm just OCD."
Right.
It's like, are you really OCD?
Right.
Or, you know, I mean, I'm
Just
not a
throwing
doctor.
it out there.
Yeah, I mean, I've made jokes before, like I'm
Yeah.
being a little OCD, but I'm certainly not gonna. Yeah, I don't know. It's weird. It's like I look at it and I do this thing kind of where I like use these kind of crazy metaphors, but it's almost like as a we've done like this tug of war with generations where we were so pulled to this side of the rope on
Right.
stigma. And instead of kind of bringing it back to a baseline, we just yanked it all the way to the other side, which is better than the stigma side,
Sure.
probably.
Agreed.
Does that make sense?
Yes.
And so, you know, maybe we can just kind of shift back to the. I feel like the world in general is like that, but we don't have to go down that road.
Yeah,
But
I agree with you, right? I think we see the pendulum in extremes, and we see that with politics, we see that with news, and that very much affects my patients. And so what I tell people is we have to focus back to ourselves, our value set, and our center, and how to do that. And one of the things that I also spend a lot of time on is, again, looking back at evolutionary theory. So something I didn't realize I'd be doing so much more of, but I've just happened to do in my practice, and is that I actually treat many couples. So couples therapy has become very
Interesting.
popular in my practice, and I think it's because of the more people gain insight into themselves, the more they realize, well, maybe there's something that's here that we've got to work on. Because when you're taking two people with two different mindsets, right, or opposites, the opposites attract, or whatever it may be, there's a lot that's there that people don't think about, and there's gaps in communication. So the top 3 things I teach all of my patients when they're in therapy with me is anxiety coping skills, because we've all got it. 2, and learning how to regulate your body. Because the thing is that when we have anxiety, your brain is saying, I control you, versus figuring out how to be in the driver's seat and saying, no, I control you and the way my body responds. And so that's huge. And there's so much mindset that's involved in there. Our brains believe what we tell it. And I did some training and saw some and have seen how the CIA and the FBI train whenever they're working with in high stakes cases and individuals. And interestingly, our brains perceive threat when we're asked a question. And so when I start with patients, I usually don't start with a question. Or if I'm looking to make a point, then I will start with a question. And I'll tell them, do you see how you answered in a very limited way? And did you notice your body language when you were answering that question for me? Versus asking the same thing in statement form. It lights up a different part of our brains, and we don't perceive it to be threat. And so we actually share way more information than we typically would. And so those kind of subtle things that I teach my patients are important, and it's the same way in the other skills. So I also teach communication techniques and boundaries. Anybody who does therapy with me, whether couples, whether individual, those are 3 things you're going to learn for sure, because that's the base of everything else that we do after that.
Right.
And something I've also found is just from an evolutionary standpoint, if we think about it, right, it's survival of the fittest. And no matter what your orientation, your preferences are, and keep in mind these are blanket statements, there's exceptions to the rule, but men generally think in risk-benefit return on investment. And the thing I also hear, especially in couples or even like kiddos as they're getting older, is, well, she's just being emotional. It's because she's a girl. She's just emotional, or she's a woman, she's emotional. And I was like, okay, sure. Well, sure. where that comes from is that, again, from an evolutionary standpoint, women do tend to be actually more resilient. They are biologically loaded that way because they have to make sure their young survive. So they're able to kind of move on, et cetera. Whereas, again, with men, in order to survive, it's going to be more risk-benefit, return on investment, less emotional. But what I tell people is hopefully we have evolved, right? And so that's why you see more attachment, right, with men being fathers, et cetera, being more involved in their children's lives, having more of that emotional component. But what's interesting is that society has also said, shame on you for being a man and being emotional. Or for women, right, shame on you for wanting to have goals or thinking more in risk, benefit, return on investment, because it's very different from what we subconsciously know.
Yeah.
Right. Interesting.
And I take that to the athletes too, right?
Yeah.
So it's interesting because sometimes I'll treat college athletes or, a variety of sports, Olympic athletes even. And I always say, look, I'm not an athlete. And they're like, well, how are you going to help me if you're trained in sports psychiatry? And I was like, honestly, I think there's benefit.
Probably better.
Because there's no bias. I don't have any skin in the game, and you can help me understand from your perspective what the sport means to you. And also walk me through, right, where we have gaps from a performance standpoint, from a pressure standpoint, et cetera, when I'm looking for patterns of behaviors. Identity fusion.
Yeah.
Absolutely.
Fear of failure?
Yeah.
Obviously, I would think. That's fascinating.
So with treating all these different demographics of person, I assume that you have to tailor your approach with each one to a point, but I guess my question would be what is common? What's a common trend in all of these sectors of person, whether it's athlete, high achiever, homeless, child? What is consistent, and what sometimes do you feel like, and you don't have to give us all your secret sauce, what do you see as different? What do you see as similar in those cases?
That's a great question.
That make sense?
Yeah, absolutely. That's a great question to ask. And first and foremost, I always like to remind all of my patients, you are a human.
Yes.
I would love for all of us to be superhuman, and I would love for me to be superhuman, but I'm still human. And one of the things that I have seen across the board very commonly is that trauma has happened to everybody. And what's interesting, though, is what we perceive to be as trauma. So that's the key, right? My trauma may be very different from your trauma, but it doesn't mean it's not.
Right.
Now, yes, I understand the DSM and the definition of what trauma is very specific from a diagnostic standpoint, but I always like to acknowledge in all of my patients, even if you think you haven't experienced trauma, you have, because it's shaped all of our decisions, our behaviors, the way we act, and the things that we do.
Right.
And I can go back and think about my trauma. I had to deal with quite a bit of adversity of not fitting in, of being in the Deep South and visually being different from other people, but also the double standard from a cultural standpoint. I come from a more conservative culture where there's a double standard between males and females, and so I wanted to prove I can do everything a man can do.
Right.
Definitely.
But it doesn't mean that I still don't appreciate some of the traditional roles. And so what I find is that so many people are defined by this trauma, and they carry the weight of that backpack. And so what I tell all of my patients is, carrying around 50 to 100 pounds is pretty exhausting. And I want to share that with you. So let me take some of it.
Yeah.
And there's other people in your life who want to take some of it and help you unload that. And so trauma is what is common across the board. Even if you had the perfect childhood and the perfect everything, we're going to have things that make us feel uncomfortable. And our brain will register that subconsciously as something that is trauma.
I asked my husband, he's a psychiatric nurse practitioner, for those that don't know, I said, does everybody have trauma? He goes, oh, absolutely. Nobody comes out unscathed.
Yeah.
We all have it. And I was like, that's so interesting. But it's the levels,
it's the self-diagnosis and defining of certain traumas in certain ways. Because obviously been in recovery and doing long-term treatment multiple times, I have taken a look at a lot of things that, a lot of people don't even realize that some of their life experiences have been traumatic.
Right.
That was my experience. They were like, man, take a step back for a second. Just think about that.
Right.
That's a lot. And I'm like, what do you mean? It's normal, and they're like, not so much.
Right.
You know? But
And
again,
then I'll, mine is nothing compared to what I heard, minimizing.
yeah, the comparison. I
yeah.
do it too.
I mean, you're right. Mine still matters.
Yeah.
Yeah, Matt, I think if you have a feeling associated with something, it matters, right? Your brain registered it in a certain way, and that's why I always say, I think about me and my siblings. All three of us have the same genetics,
Right.
right? We have the same parents, and we are all so wildly different.
Yeah.
Right, in personality, and think about your own children if you've got them. Think about
Right.
how wildly different they can be.
Right.
Yeah.
And so it's interesting because one may be more sensitive than the other. One may perceive it, and something else I always like to teach and share, and something I start with all of my patients is perception is everything.
Mm-hmm.
So what I'm looking to do is understand your perception, and that is huge when I'm doing couples work.
I bet.
And to follow up in terms of what do you see that's different, what I've seen that's the most different with the variety of populations that I treat is the level of control. So I have found in my higher achieving, maybe private practice athlete population, people who have been very ambitious, very disciplined, have a certain standard that they require for themselves and the people around them, quite frankly. There's a sense of control that is absolutely essential to them in what they do. And that comes across in treatment. And so what I say is, well, you've met your match.
Mm-hmm.
Checkmate.
Yeah.
Let's go.
Yeah.
Right. And then I have found, though, in my population that have still experienced trauma, but truly are just grateful for any help they get, there's some hesitancy, but there's less perception of needing control and care. So I can't tell you how many times at Harbor House I've had patients say, I trust you, you're my doctor, just do whatever you think. And I actually encourage them to do otherwise. I encourage them to ask questions, and I encourage them to understand why I'm recommending what I recommend, because I want for them to have that sense of autonomy.
Right.
And so that's the biggest difference I've seen across populations is just what level of control people want to have.
Interesting.
And then what's similar is just that everybody's been through something. And so
Right.
you're still treating someone who's human.
That's right.
And I also like to encourage my patients, the ones that I treat at Harbor House, I always tell them, I was like, I know that you see me and it's intimidating. I know you think of somebody who is successful, who has their life together. It's like, but just remember, I'm human too.
Yeah.
I've made decisions I'm not always proud of, but the key is that I've continued to bet on myself, and that's something that I want for you to consider.
Right.
That's
You can get there.
Absolutely.
Bet on yourself
Yeah.
right now.
Right.
Just commit to doing it right this second.
Exactly.
Right this second.
Yeah, that's it.
I always say the biggest investment you can make is in yourself. And what
Mhm.
does that look like? It's so easy for us to invest in material things, which
Oh,
I find fascinating, right? Because again, there's a societal standard. But what society has not taught us is this investment in ourselves. And I think that's also a big movement that I'm starting to see overall. And I hope that with continued education, people realize that there's something to it.
Right. Yeah. 100%. Yeah. God. In another life, I'm like, I wish I was a psychiatrist.
Me too. I'm just fascinated by it.
Um,
Okay, so what's the most fascinating diagnosis?
Yeah. What are you? Yeah,
Like-
that's a great question, Courtney.
It's just something I have to
Or
know.
what do you wish you knew more about too? I want to know that also.
I am one of those people where I think being very type A, I say go into medical school requires all kinds of discipline and structure. And as humans, we tend to like structure. We tend to respond very well to structure.
I do. For sure.
And I think something that, as much as I respect and appreciate the DSM and the amount of work and just being able to have a language where we can all communicate with each other, what I don't love is really boxing people in. People will
Yeah.
tell you what's wrong with them if you just listen.
Oh yeah.
And so for me, what's so fascinating is often how some diagnoses are underdiagnosed. So for example, one of my favorite things and something that I do often is, and I say favorite thing, not in the sense of I want to diagnose someone and, I understand how difficult that can be, but that light bulb moment for them when they feel educated and they finally feel like there's light at the end of the tunnel.
Right.
But one of the things I see very common is major depressive disorder being diagnosed over and over and over
Yeah.
again, and you see the same treatment over and over and over again. But in fact, bipolar 2 disorder and major depressive disorder look almost identical in people. And so you have to take a different approach. And oftentimes, if you treat the patient like they have bipolar 2 disorder, 9 times out of 10 they do. I
Yeah.
think it's much more common than we realize, and that to me has probably been the most fascinating, and to see people get better. So
Yeah.
the part that's so exciting for me, 100% of my patients who have started my clinic have stayed with me, and I'm really proud to
That's
be able to
awesome.
say
That's
that.
great.
And my goal is to always get them better and get them back to their primary care unless they want to continue seeing me. But that's been the neatest part, is to diagnose them correctly
Yeah.
and to see them get better. And those are some of the diagnoses that you don't really get a chance to see until you start doing more of that work and gain clinical experience. And so if you think you have depression, you're like, I'm not getting better and I've done everything. Well, maybe we got to go back to the drawing board with diagnosis.
Right.
Yeah, for sure.
Yeah.
What do you think? How do you feel about where we're at as a state right now?
That is a loaded question.
Yes, it is. Okay, yeah.
But I'll say this. I do think there's a lot of work that needs to be done. I think, again, there's a stigma that's related to, being in the South about mental health care. I mean, I can't tell you how many families I've treated at this point where they've come to my clinic and they're like, yeah, and so he's been like X, Y, and Z. And I was like, and so that feels normal to you? And they're
Yeah.
like, yeah, that's pretty normal, but it's just gotten out of hand recently. And to me, it's fascinating just how much lack of education there is.
Right.
And this idea of we've got to keep it a secret. And again, I don't see that so much in the younger generation, but I'll say my generation and older.
Yeah, for sure.
There's a lot of that there. And interestingly, in my practice, I see more older males than I do
I bet.
other types of the population. And you can see the look on their face when they get seated and they look at me and they're like, you could be my kid. How are you going to help
Yeah,
me? Right?
yeah, for sure.
And I love playing into that. And I was like,
Oh,
again,
yeah.
you have met your match.
Sit
So-
back and watch.
and one of the things I always
Sure
ask
could.
people is give me three visits. And then after that, you decide, if you feel
Yeah.
like you'll benefit from this.
That's
And
awesome.
everyone has stayed. And so I wish I could box that up and
Yeah.
show our legislators that and show, our leadership in these areas. I'm grateful because I do think that we're starting to see that just overall in the administration as well, just some interest in mental health care and
Yeah.
what that looks like. I mean, there may be different viewpoints on how to go about that. And that can be kind of scary, as we just think about how landscapes change as a whole. But one of the things that I truly believe in is what I will always be an advocate for is what evidence-based medicine is. Having physicians at the healthcare team leading that, because of the amount of training that we've had, and just continuing to have the conversation. So with all of my years of experience, even in advocacy and organized medicine, I've developed some amazing relationships with
Yeah.
our state leaders, and many of them have watched me grow up, so to
Yeah.
speak. So they've watched me since the beginning of medical school till now. And what's really neat is that when some of them do have questions about mental health care, it's nice to be the least intimidating person for them to pick up the phone and say, hey, can you just help me understand this? And I think the other key thing is not to be reactive. What
Yeah.
I have found is that when something is something that we're very passionate about, we're very emotional about, if we become reactive, people have already stopped listening. And so I always take the information that I get, I nod my head, and I like to process that. And so I don't always immediately respond either. When I'm having difficult conversations, even just including from a state standpoint, with some of the administrative roles that I have, I always like to take an opportunity and think, what made them have that perspective that they have, and what's my goal here with that, right? And so if you become reactive to that, you're not going to get anywhere.
Yeah, no way.
And I think that's what we're seeing. We're seeing that across the board, not only in our state, but in other places and spaces. People are reactive and emotional, and understandably so, because we're only human. But I think that's something that people should consider as they're, thinking about their leadership and who they work with, as well as elected officials and all kinds of things.
Did you learn to not become reactive,
Yeah, I think
or was it just natural?
definitely not natural. My
Yeah.
siblings
I'm a
can attest to
reactive.
that it was not
I'm a
natural,
reactive.
and my
Yeah.
parents can attest.
Me too.
I think that also comes with age, right? It
Yeah.
comes with age and life experience. And like I said, one of the things that people don't talk about enough is how much our hormones also affect our mental health and those
Mhm.
changes. And we'll see changes for women. You see changes premenopausal, right, during pregnancy, and then postmenopause.
Right.
And then also in our males as they go through puberty and those major testosterone shifts and changes. And then, of course, if our males are using, right, steroids and other things, what a big role
Yeah.
that can
And
play.
nowadays,
sure.
the amount of peptides and
Right.
hormone replacement stuff, I mean, it's
That's a lot for our brains and our bodies to
Yeah,
handle
Yeah.
and
it is.
process. And so reactivity when we're going through major shifts is pretty natural to happen.
Right.
And I'm not perfect. I mean, there are certain times of the month where I could tell you I may be a little bit more reactive than others,
Right.
right? And I think that's important to kind of understand yourself in that. And so one of the biggest changes I've noticed in myself in my early 20s to now in my early 30s is just the sense of reactivity. And that was a pattern I observed when something did not turn out the way that I wanted it to go, or if I unintentionally hurt someone or anything like that. What was that? And that's what I work through with my patients is what is that?
right.
And it allows us to kind of get a bird's eye view on the way that we're treating people and the way that we're reacting. And I was like, we can't control how other people are going to react or what they're going to say.
That's right.
The only person we can control is ourselves and the way we react to that situation. And so that's usually a big part of therapy too. And what's interesting is that, what I've found is that people tend to do really well when you can make those connections for them,
Yeah.
right? When
Right.
the light
Sure.
bulb moment goes
Right.
off. And so I look at the state of the state that way. I look at working with legislators and other leadership that way. And the other thing that people have to understand is ego plays a huge role in the way that we also are willing to absorb information or change our behaviors. There are things that could be ego dystonic, which is against what our ego would feel comfortable with, and ego syntonic, which is very supportive of what our ego is comfortable with. And so even taking that into consideration in the language that you use and the way you approach different people is going to be really important. And I think all of those things play a role in, even access to mental health care, viewpoints on mental health care, the way we see mental health care in general.
So I'm a trend guy, and maybe it's the finance in me. Like right now, I'm kind of seeing from where we are, like when chaos is kind of happening in the world around us, whether that's macroeconomic or geopolitics or whatever the case may be, do you see a reduction in people's willingness to get help when things like what's going on right now are going on, or do you see an increase? Because I'm seeing a reduction, and I'm wondering if it's based on fear of whether it's financial or what do you see? I'm curious.
So I fully agree with you because, right, intuitively we would think there would be an
Right.
increase,
Same.
but there's
Yeah,
not.
that's what I was thinking.
I've seen a reduction because, again, it has to do with where we're prioritizing what this means to you.
Mm-hmm.
So again, there's a kind of it's our body goes into fight or flight. We go into self-preservation mode, and let's be real, mental health is one of the first things for people that they feel like can be cut because they're like, humans are resilient. They'll figure it out.
Yeah.
We didn't have
I'll
mental
do it
health
later.
care before,
Yeah.
right? We'll
Yeah.
do it later. But in reality, the truth is that 2026 is a very different time from then, right?
Yeah.
What our basic needs have changed.
Yeah.
And I think it's going to take a little bit of time for that to catch up. But I agree. I think it's interesting, finances play a huge role in terms of, okay, what do I need to do? So this was interesting. I was listening to the radio and I was listening to the data on this, and I just found it fascinating. And I remember having a conversation with my parents about it and even some of my patients about it. So 60 to 80% of people are willing to be in debt to continue to show off the lifestyle that they have in this
yeah.
perception.
I believe that.
And I
Absolutely.
found that to be interesting. And so in reality, when you look at, changing what the core factors are for people to be able to get to recovery or hit goal from a mental health standpoint, all-encompassing standpoint, two of the things that I've seen happen the most is finances play a huge role in that, as well as their relationships. Right? Their relationships typically in their immediate family. Those are the two most common starting off reasons that people come to me for. They say, well, I'm depressed, I'm anxious, or I've got this going on, that going on, or I'm going to lose my family, etc. But it always kind of comes down to some of these core things. And so it's interesting to see just what people prioritize, what's important. And I think this societal expectation, and again, I think social media has made it even worse, of this idea of what we have to be, has really made people afraid of going and getting the help because they're like, well, if I just do this one more thing or that one more thing, it'll fix things for me, right? And there's so much misinformation and disinformation out there, quite frankly, and that could be a whole other episode if we wanted it to be.
Yeah.
But I think that's what's scary is that people are willing to absorb information from anywhere and not really looking at what the accreditation behind that information is, and particularly with our young people. So I saw a recent statistic that from, I think it was the Pew Research Center, where they talked about how I think if you're under the age of 15, essentially, they do it by generations, they get 100% of their information on social media.
I believe it.
And
That's
so I think
terrifying.
that has also reduced people seeking care because there's so much information.
Yeah, they can get all the answers
online.
they
Right.
need with the
Right.
click of a finger.
Right.
Yeah.
And now with AI really coming in, there's a lot of, that adds another layer of concern.
Yeah.
I think it's a beautiful thing. It's so neat to see how, how revolutionary this
It
can
is.
be.
It really is revolutionary, but it is also extremely terrifying.
Because at the end of the day, what I say is we're only human. It's
Yeah.
like Adam and Eve and the apple.
Yeah.
Right.
Right.
How do you balance that?
Yeah.
Who's
That's
going to
right.
be there to keep you accountable?
Mm.
That's right. I was going to ask you, do you see a lot of grief clients?
Yeah, that's a good question.
Yeah.
Quite a bit.
Just-
Yeah, I see quite a bit of grief, and grief can come from a number of places. It can be the grief of what someone used to be,
Yeah.
what someone used to feel and experience. It could be grief over physical loss of somebody, but it can also just be grief about not having your life be what you thought it would be.
Yeah, for sure. Grief is a long
Never
process.
thought about that before.
Have you ever read the Grief Recovery Handbook?
I don't think
before?
so. No.
I read it a couple times.
Really?
I was told to. Required
Grief
to
Recovery
even.
Handbook. I'll
But
write it
it's
down.
I think it's the Grief Recovery Handbook. I think it's purple. From what I
Okay.
remember. But
Okay.
anyway, that's a good question. Grief is intertwined with a lot of different things also.
What I've seen the most, so for example, with my retired athletes or people in recovery or new to recovery, I should say, the biggest thing that I see is they grieve the person that they were. They grieve what came with it,
Yeah.
right? And that's really hard for people.
Sure.
But what I also see is people who have this idea or who are placing that immense amount of pressure, and if they didn't reach goal exactly the way that they imagined it, there's a lot of grief over that.
Right.
Yep.
Yeah.
Sounds familiar. Yeah, sounds very familiar. Well, this has been fantastic, and I feel like we could
Fabulous.
go for a very long time.
Oh, I could go for a long
Yeah.
time.
Well, our listeners will have to let us know if they want
Yeah,
a round two.
That's
That's
yeah. We
right.
can do it. We can do a volume 2 for sure. How in the busy world of Dr. Patel, we ask all of our guests this, but with you, I'm very curious. How are you taking care of yourself?
This is an amazing question. I'm super big on practicing what you preach.
Good.
So one of the changes that I've made is incorporating all of the lifestyle psychiatry factors into my life. And one thing I tell every single one of my patients, I'm not going to ask you to do something that I wouldn't do myself. And so
Love
I
that.
even tell my patients, I realized I hadn't taken a vacation over a year, but I love what I do, so it doesn't really feel like work to me.
Mm-hmm.
But sometimes you realize, you're on the burnout train. You're headed toward the burnout train. And it was
Mhm.
something that I recognized in myself. We could go on and on about some of those things too. And that's something that I see very commonly in the high achieving population.
Yeah.
And again, with societal expectations and when you've got kids and a family and work demands and all of this that we think we have to do. Well, I'll give you an example of one recently. I had a really great friend who did incredible and fundraised all this wonderful money for a nonprofit organization. And we had the big event. And you know what? I just couldn't be there because I needed to take care of myself.
Yeah.
I needed some time with solitude. And so I got up and I went to the beach.
Yeah.
I needed some sun, sand, and water. And
Yeah.
one of the most healing things for me, and I encourage people to find that, is what heals you and what allows you to feel the most centered. And so I spent 3 days, it wasn't very long, just enjoying the sound of the waves and nothing else.
Yeah.
And I told people, if you need me, of course, I'm always available from an emergent standpoint. But I found my patients are very empathetic toward that.
Yeah.
They understand that, in order for me to, and one thing I also tell them, in order for me to show up for you at my best, I have to take care of me.
Yeah.
That's right.
And so I exercise just about every day. I'm
Good.
a Pilates girly.
Awesome.
So I do enjoy that.
Yes.
And, clean eating is really fun. But also, I eat with my family at least 4 to 5 days a week.
I'm
Minimum.
glad
Really?
you brought that up.
That's a non-negotiable for me. And I also do something with friends once every 2 weeks at minimum. And if I can do more, I will.
Yeah.
I'm not going to turn down a social event because I don't feel like it. Work will always be there.
Yeah,
Right.
for sure.
And so sometimes it means asking for an extension on a deadline so you can show up for the people that you care about. But
Yeah.
I'm really happy with how my life has looked. And, for me, I'm not married and don't have children. But one of the other things I've also prioritized is I do hope to find a life partner. Now, I want to be myself,
Yeah.
but
Right.
I've opened myself up. And sometimes that means, something's got to give in order to be able to have time for that.
That's
right.
right.
That's
Absolutely.
right. Good for you.
Yeah.
And so
That's good.
that's how I do it. But I love what I do, and I'm always open to opportunity. One thing that I will say, and I think it's important to share this even on the podcast, is people talk about, what I've seen is people have really developed these very solid niches in what they do. And I always thought I would be that person. And I've realized that instead of boxing myself in, it's okay to continue to pursue the things that I love. And there are a variety of things that I love.
Mhm.
And maybe one day I'll get tired of all the other things and I'll want to do one thing. But nothing has to be permanent. And I think that that's this fear that so many people have, is if I box myself into one thing, that's all I can ever be. Now, granted, I don't know that I would pivot careers because that's a lot of
Yeah.
investment I have made, and I do love what I do. But even with that, you can open up Pandora's box with what you can do, and I think I'm living proof of that, because all I ever thought of being a physician, being a psychiatrist, is I'd work for a hospital system or a center, and that's all I would ever do.
Yeah.
And I think I'm living proof that your life can be so much more than that.
Yeah.
And for me, I also think understanding yourself, and this is why I also offer executive assessments for people, or people who want to understand more of kind of how they function and what works best for their lives. So I realized, and very early in training and residency, my chair, Dr. Ladner, can attest to this, and I love him very, very
Shout out
much.
Dr. Ladner.
Shout out Dr. Ladner. He said to me, he was like, yeah, you don't do really well with someone telling you what to do. I think you're going to be really good as your own boss. But something he said that was really special to me, and I think it really inspires me, and remembering to have that sense of community in your life is so important. He told my parents at graduation, and I may be embarrassing him for saying this, but he said, in all of my years of practicing psychiatry, I've never met anyone like your daughter, and she is a
Oh,
unique
wow.
bird, and we love her for that. And he's like, and it's just so impressive to see that journey. So having those people on your team and celebrating just you being you, and understanding that no one's journey is linear,
Yeah.
and it
Right.
doesn't have to be.
Right.
But you have to figure out what makes you happy. And sometimes you may want to get help with figuring out what that is. And sometimes life will allow you to figure out what that is. And so for me, I knew being my own boss, making sure I practice what I preach, is going to be really important. And I think the right people, whether you're a person of faith or believe that the universe will figure it out and will bring you the right things.
Absolutely.
Amen to that.
Amen.
Yeah.
You were
Man.
lovely
Yeah.
and glowing when you're talking about what you do.
Yeah,
I
yeah,
just,
you
this
are.
has been wonderful.
Thank
Well-
y'all so much. I'm so honored to be here. And just like I said, I'd be happy to be here for part 2.
Yeah, there you go. We'll do it.
Absolutely.
Well, we will make sure we tag you whenever we post all the things, and make
Perfect.
sure, you
What's the
reach
name
out
of your
to her.
practice?
Mississippi Psychiatry and Wellness.
Awesome.
So-
In Jackson?
In Ridgeland.
In
Yeah, it's in the
Ridgeland.
Renaissance. Mhm.
Perfect.
Renaissance. Perfect. You got
Yeah.
anything else?
That's it. Thank you so much.
you
Great
for having me.
episode. Thank you.
Yeah, I know we skipped around a lot, and
No.
I'm sorry because
Oh, no.
we totally did not follow your outline.
No, we never do.
Yeah, we never do. That's exactly
but
right.
as long as we have it, we can just kind of go like this. We never go this way. We
Right.
always
Yeah.
kinda
Exactly.
find
Yeah.
ourselves
We
I
in
think
covered
we
it
hit on
all.
a lot of good things, though.
Yeah.
So.
Did great.
So. All right, guys. Thank you all for tuning in. See you next time.
Next time.
Thanks.
Thank you.